Hi, this is Dr. Juan Lopez, and I want to thank you for clicking on the link for this very important announcement. We're working hard to get the office ready for reopening. In the medical profession, dentists, dental hygienists, and dental assistants are amongst those that are at highest risk of exposure to COVID-19. We're securing the necessary personal protective equipment for our staff to meet COVID-19 requirements. We are improving the airflow in the building, therefore dramatically improving air quality. We're obtaining all the necessary surface cleaners that meet current needs. Daily monitoring for your safety of all information from the CDC, New York State Health Department, American Dental Association, and OSHA is being actively done. We're preparing for a new normal. Under this new normal, if you're sick with a fever, sore throat or cough, chest tightness, loss of taste or smell, if you have stomach problems like vomiting and diarrhea, if you have a pink eye, or you develop a purple rash on your toes and fingers, stay home. If you or someone you know has been exposed to a confirmed COVID-19 patient, stay home. You will be required to enter the office wearing a mask, and you must wear it except during active care. It has been shown that a patient that is not symptomatic but has COVID-19 comes into contact with somebody that's not wearing a mask, the probability of transmission is 90%. The same study shows that that same individual, COVID-19 non-symptomatic, comes into contact with an individual wearing a mask, the transmission rate drops to 70%. The person that has COVID-19 not symptomatic and it's wearing a mask now drops the possibility of transmission to 5%. If both individuals, the non-symptomatic COVID-19 positive and the person that's not infected, come into contact and both are wearing a mask, the probability of transmission is 1.5%. Under the new normal, when arriving at the office, hand sanitizer will be available for it to be used upon entering and leaving the office. Your temperature will be taken before entering treatment areas. A reading of 100.4 or less has to be shown consistently. Our waiting room will no longer offer magazines, children's toys, coffee, and water bottles since these items are difficult to sanitize. Under the new normal, only the patient receiving treatment is allowed in the office. Family and friends must stay outside. Seating in the waiting room will follow social distancing rules. You may be asked to stay in your vehicle and called into the building for the appointment. This may be done to control the number of people inside the building at one time. Walk-ins are not allowed. Please call us first if you're having a dental emergency. This helps control the crowd size. Under the new normal, appointments now have to be managed to observe social distancing. We also need extra time for new disinfection protocols. This means that we cannot offer the same scheduling options we once did. Under the old schedule, our intervals were 45 minutes. That allowed us to be efficient and see many patients at one time. Now, the intervals have to be changed to hours, therefore reducing the amount of appointments that we have available, as well as the times available for these appointments. If you have an appointment scheduled, you will be notified soon of a new time and date. If you lost an appointment, we are doing our best to find new times for you. Rescheduling options will be limited for the foreseeable future. We realize that some of these changes are difficult and frustrated. I am committed to continue working diligently to transition into our new normal. The office will resume full operations once we have upgraded the building to satisfy all new infection control protocols and have secured the necessary personal protective equipment. I personally thank you for your understanding as we prepare to reopen Dental Health Solutions. Please share this video to help us educate all dental patients. Thank you.